Welcome to Talk of the Town. Dieesha Hicks has joined us once again. She is with the Lowcountry Council of Governments, and as you know, she shares information with us about Medicare and Medicaid and prescription drug coverage, and that's what we're talking about today, a program called Extra Help. So Dieesha, you want to just jump right in and let us know really what extra help is out there available for folks.
So Extra Help is administered through Social Security. It is help to help lower that drug cost. So if you qualify for Extra Help, it helps pay those co-pays, co-insurances, those deductibles, and those drug plan premiums.
And so let's talk about qualifications. You mentioned if you qualify. So I would think they're pretty strict.
It is. So the income limit for 2025 is if you're single, the max income you can make, and that's including your Social Security or any working income, is $1,957 if you're single and $2,644 a month if you're a married couple living together.
All right. So let's talk about how you even learn more about this program. Do they call you? Do they go on a website? So again, I've never actually heard of it. So is it a new program?
It's not new at all. The thing is just trying to get people to understand and to know that it is out there. Sometimes Social Security will send them a letter if they see that they may fall in that income bracket. Last year, CMS sent a letter out to people. They just tell them to either call us or either they can do it themselves. So I do help a lot of people enroll in the program.
All right. So let's talk about other programs that have some financial help with healthcare costs, which seem to constantly be escalating.
So the Medicare Savings Program is another one that is administered by the state that helps pay that Part B premium, which everyone, if you're on Medicare, you should know it's $185 a month if you qualify for that program. And there's several levels to it, but the highest income, so you can qualify if you're single, is $1,761 a month. Again, that is Social Security benefits or working income. And if you are married, it's $2,380.
All right. Anything else that we might need to be aware of to help save us money? We want to save money, Dieesha.
And a lot of people, Medicaid. So Medicaid, I help those who are aged, blind, or disabled, meaning they're 65, they're blind, or they've been deemed disabled by Social Security and low income. So that max income is $1,305 if they're single and $1,700 if they are a couple. So Medicaid comes in secondary to Medicare. So it helps pay those Medicare co-insurances and co-pays and things like that. So you don't have those major out-of-pocket costs if something happens to you.
All right. And again, to have people that have lots of questions, because it is so complicated, all of these various programs. And I know folks say, where do I turn? What advice, what path should I take? What advice should I get? And you're only one person. I mean, I know you have a staff, but it's just, and I appreciate you coming on WHHI every month to help sort things through because it's so complex.
Hey, just feel free to call me. I'm here to help because I know that this can be a complicated world, this Medicare world that we live in. It is quite complicated, but I do want people to know if you think you qualify, just give me a call and we'll go through it just to make sure you don't. But anything you can save is a blessing, especially with those drug costs.
Right. And we're coming up on May. Next week will be May 1st. So is there anything that we need to be thinking about for, and I know open enrollment comes in October, I think it is.
October.
Okay. Anything, we just have just a couple minutes left. Anything else that you need to share with our viewers?
So even though we're not in those enrollment months, we still have those that are coming into 65. Just make sure that you get enrolled and remember that you have to go through Social Security first unless you are already receiving your Social Security retirement benefits.
All right. Anything else, Dieesha?
That is all. Just I'm always here if the people need me, and I'll see you guys next month.
All right. And hopefully in person.
Hopefully in person. Fingers crossed.
Thank you, Dieesha Hicks.
You're welcome.
With Lowcountry Council of Governments. Once again, thanks, Dieesha.